You're listening to the Movement is Medicine show, a podcast hosted by Head to Toe Spine and Sports Therapy, a modern chiropractic and manual therapy practice in Edmonds, Washington. Now, let's get into the show. What's up, everyone? Welcome to the show. Today, we have a pretty cool topic. It's a little bit science fiction meets a little bit cutting edge medical treatment. And of course, I'm talking about laser therapy. So we have the incredible team from Head to Toe here on. We have Dr. Ash, Dr. Tim, Dr. Lee. Welcome, everybody. How's it going?
What's up, Barry?
Going good.
Hey, guys.
Awesome. What's up? So guys, today, one of the things I want to talk about is laser therapy. Now, it's something that I've experienced a couple times at the clinic. And I know that we happen to have the laser therapy guru here on the show. I know, Dr. Lee, that this is something that you're super passionate about and something that you use in a lot of your healing modalities and a lot of your healing protocols. So I'd love to kind of get into, what is laser therapy, fact or fiction. I think this is one of those things that people sometimes are a little bit unsure of how it works or if it's really working or doing something. So I'd love to dispel some myths on it and then talk a little bit about maybe where we see its best use applications. And then we can kind of round robin on how we've used it or ways that we've seen it in the past. But Lee, why don't you kind of kick us off on laser therapy? What is it? Does it work? Is it real? Is it legit? So break that down for us. And then from there, we can kind of start getting into where we use it to treat things.
Yeah. So basically just in one answer, it works and it works really well. But the big thing with infrared light is it's basically, laser, it's a concentrated beam of infrared light, right? So like when you have light from the sun, you have both infrared and UV light. And the cool thing about infrared and UV to some degree as well is that they help to stimulate cells to work at a faster rate, to create more energy, and overall normalize processes in the body through amplifying what we call our circadian rhythm. So a lot of cool things that occur with infrared light, but some of the big touch points are going to be you basically need specific wavelengths to affect tissues as specifically as possible. So without getting into numbers, there's red light, which is visual, right? You can see that will have some sort of effect on skin and the eyes, especially. But when you get into some of the higher nanometers, like 800s and 900s and things like that, they can actually penetrate through the skin, get into the cell, and basically cause the mitochondria to create more ATP. And the more ATP available, the more the cell can work and do its job. So basically, the laser is a concentrated infrared light beam that, we can kind of get into a little bit of more debatable topics in the sense that it's going to recreate similar infrared, frequencies as the sun. So we all know that we get light from the sun. The sun is energizing in and of itself, and with that, it's basically using that in as specific an area as possible to try to cause decongestion of lymph nodes or heating up tissues to allow for more blood to flow, things of that sort.
Right. So there's all kinds of, so if we would just step back more broadly, we'd say over the last, 20, 30 years, laser has seen all kinds of applications in the medical space, in both medical space and in med spa space and healing space, all kinds of spaces. There's all different kinds of applications for laser. So if you're thinking a little bit of I hear laser, I think Star Wars, and then I'm I don't know if this is science fact or science fiction. Just to start off, it's totally science fact, and it's used on all kinds of different ways. Obviously we have laser, we have LASIK, which is laser assisted eye surgery. We have all kinds of different things with lasers in the intensity of that laser. So you're talking about here, how the laser that we use is what kind of class would you say? So if on one hand, you have lasers that can burn through flesh or whatever. And,
right.
And then you have that at-home laser maybe that you got to help with wrinkles or something, like an at-home version. What kind of laser do we use in the clinic?
Yeah, so there's the main three that you want to know is class 3, 4, and 5. So you're never going to use class 5 on yourself because that's a military grade laser that is literally developed to bore holes through the sides of ships and or buildings. A class 4 and a class 3 are typically what you'd find in the medical setting. Class 3, because it's less concentrated than 4, it's basically called a cold laser. Whereas class 4 is typically just called class 4 laser or hot laser, depending on where you're at. Class 4, you have to continue to move at all times, whereas class 3, you can just kind of hold and stick on one point. And we have class 3 in the office here. It's a little safer to use, a little bit more conservative, but still effective. And I've used both class 3 and class 4, and they both have their pros and cons. But overall, they both work. It just depends on where you're putting it specifically and what exactly you want to do with the therapy.
Excellent. Speaking of therapy, so when we're thinking about this, how we use it, where you feel like it has the biggest impact. What are some use case scenarios where maybe if somebody was coming in with a particular issue, where would we be using this? And it sounds like it has like a broad, like a general application. Like you could use it with a lot of different inflammation issues or ligament or tissue issues. It sounds like we have like a broad use case where it's like a lot of stuff we could use it on. But it also sounds like maybe there's some real specific stuff that you feel like it's really a great fit for.
Absolutely. I mean, the main specific things we use in the office are for neuropathy. So like any nerve pain, whether that's actual pain, weakness, tingling, burning, numbness, that can help to basically normalize the nerve flow into an area. So whether you have diabetes or you've gone through chemo, or I have a patient that is HIV positive right now that takes medications that cause neuropathy, those are people that see substantial results just within one session typically. And I've seen in the past, just as an anecdotal case, a patient with diabetes that came in with basically like didn't look like he had an ankle, like the calf and the ankle were the same swell size. He received like a 10-minute treatment on each ankle. And by the time he walked out pain-free, and you could actually see tone in his ankle and his mortise joints. So with that, it's going to amplify blood flow to an area, but it's also going to stimulate the lymphatic organs to reduce congestion. So it can help with venous return, lymphatic return, et cetera, so forth.
Generally speaking, how long does the laser treatment, is it something like for a lot of our treatment methodology and style, we kind of move people through treatment phases where oftentimes we're working on getting them out of acute pain, creating, and them starting to create some stability there, and then starting to build on that and create strength, and the ability to move properly. Is this something that's used throughout kind of a person's entire journey, or is it more on the upfront? Like if you're coming in and you have like a particular issue and you're in pain, are we going to see it then, or is it going to be something that you're going to use kind of along the process to amplify just the whole healing journey?
Well, you absolutely can use it throughout the entire healing process. Another case I can speak to is I basically had a rugby player that came to me with a high ankle sprain that was essentially plateaued after 6 weeks. It wasn't getting any better. He wasn't able to do anything more than just walk. Upstairs were painful, jogging was painful. So it turned into like a chronic case where he had like a lack of mobility. What the laser did for him was it reduced that congestion around the ankle and also the pain that was associated with that. So he was able to move the ankle more, and it provided him with the window to do his strengthening and corrective exercises that he was prescribed. And over time, we didn't need the laser as much because he was able to move more sustainably because his muscles and joints were moving the way that they should. So I like to use the laser to give me a window to like treat people and give them corrective exercises. But in and of itself, it can help with proliferation of ligaments or muscle tendons, or just like basically everything coming back into the way that it should be, like if there was a tear of some sort. So it can be used like literally the same day, or it can be used like chronic down the line, like 6 months after an injury. So very versatile and very useful.
Super cool. Be curious, Dr. Tim, Dr. Ash, be curious to hear from you guys on your experience with laser, or when you look to use it, or if you haven't used it as much. Be curious, what thoughts you have for Lee on it, or what questions you might have.
Yeah, I feel like it's very, very similar instances to what Lee's kind of been talking about, where it's like for myself, if I find that like an area seems to have kind of like some excess congestion, some fluid in that area, maybe the lymph is kind of backed up in that area, the area is not moving as well. That's definitely going to be a time that I do use the laser. Also, if it's something that kind of does come down, what Lee was just kind of touching on, when it comes down to kind of that musculotendinous junction, kind of some ligament type injuries or anything like that, I've definitely had some great benefits with patients using it in that setting. And really, it can be used, like Lee was saying, at any point during the treatment process, which is really great about it. I do find that sometimes, at the beginning, sometimes when people are coming in and the joints haven't been moving as well, the muscles haven't been activating correctly, things are just stiff and kind of bound up in general. At that beginning point can be a great time to use a laser because, like Lee said, it gives you a window of opportunity to get some exercise in and actually get some of that more blood flow to the area. I mean, one of the things that the laser does, like Lee was touching on before, is kind of can do some vasodilation and increase some nitric oxide throughout the blood flow. So, I mean, the fact that it can do that really does make it a great thing to use before we do therapeutic exercise. But if anything, just to kind of get things moving, get some of that congestion out of there at the get-go from patients when they're coming in, so they can actually gain some proper motion back. So really, I would say for myself, like those are kind of the big things that I use it for. But I mean, there's multiple other uses for it as well. But I would say for myself, that those are typical treatment styles that I'll kind of use that on.
I mean, the guys are hitting all the high points here with laser. I think it's a really great combo passive modality with, any of the active stuff that we do here, whether that's, manual therapy or corrective exercise or chiropractic manipulation. It's just a great passive therapy that we use, that I've used also. And recently I've tended more towards, the fasciitises, like plantar fasciitis, for example, or any of the tendinoses or tendinopathies, any of those like wider structures that maybe need a little bit more fibrotic breakdown, more blood flow, everything that the guys have mentioned. Really, really good modality to use in any of those cases. And obviously, the research and like everything we know about it like increases over time. And there's so many other things that we can use it for, and we're so lucky to have it. And I think it's something that we'll continue to use like for a while, for a long time. So
yeah,
I think it's awesome.
Self-oriented, selfish question. I always feel like every time we're on the show, I have some different ache, pain, or issue that the show is custom tailored for me to ask about. And the show, of course, is no different. So I've been doing a lot of pull-ups lately in my home gym, and also, doing some barbell work, cleans, some curls, working on getting those guns back and ready for summertime.
Those glory muscles, yeah.
Glory muscles, yeah, absolutely. And I'm definitely getting some pain, some fairly intense pain in my left elbow, like the inside elbow. Maybe that's the golfer's elbow. I'm not sure if that's what that is referred to, but is laser something that we would look at for that? Like, if that was an issue I was going to come in for, how would we address that with laser?
Yeah. I mean, definitely laser is something that you could absolutely use for that. I mean, pain with the fact that you're doing all the pull-ups and everything like that and having the pain on the inside of the elbow, it's definitely something that I've seen before. And I mean, the laser would definitely be a great thing to utilize. You can utilize it in the elbow and everything like that. Sometimes with the laser, I like to pair that with doing something like some instrument-assisted soft tissue, which is something I do quite a bit because you kind of break down the tissue and the fascia a little bit, get the laser on there afterwards, which then helps things kind of repair, increase some blood flow after doing that, and then go through some therapeutic exercise after that. So the elbow would definitely be a great spot to kind of focus in. But anytime we're kind of noticing something elbow pain related, the fact that you mentioned you're doing a lot of pull-ups, well, then we'd obviously want to look up into the shoulder and the back as well, right? And doing as much as you're doing in terms of the pull-ups and kind of cleans and all that, we're definitely want to take a look kind of in that axillary area where we do have a big lymph patch that sits there. And that could be a great spot as well that might be a little stagnant right now, just not quite flowing as well through there. It might be a little gunked up. So getting that to release, getting the laser in there to kind of get that to mobilize, get some more blood flow there as well, get that lymph to actually move a little bit would absolutely help the elbow as well. So kind of a little bit of multiple different places you could use the laser in that situation as far as what I see for that.
Yeah, going off of that, I feel like in general, like any of the extremity joints, whether it's a shoulder or an elbow or a wrist or a knee or an ankle, are all just in general very good places to use the laser. I feel like with those joints and the movements that need to occur in those tiny areas, say, for example, a shoulder or an ankle. Like there's a lot of tendinous and ligament structures in there that is moving within a small space. So like buildup in general is going to happen in those areas. And those are joints that you use all the time. So, if anybody listening, if you have like extremity issues in those areas, the laser would definitely be something to look into if you are experiencing, something similar to what Barry mentioned, just like overuse after doing XYZ. So just something to like keep in mind, I think. Extremity joints, great with the laser.
Okay, good to know. Yeah, and like so many things, I know that whenever we have localized pain like that, we're almost always dealing with a situation that is, flowing across multiple different parts of the body there. And so you mentioned with the elbow pain, we'd look at the forearm, we'd look at the shoulder, we'd look at the back, and that most likely there's a whole set of interwoven situations going on there. And now I can just easily go to the website and click book now, and I can get boom, an appointment. Now, for something like that, is that like 15-minute appointment what you think I would book, or should I book a 30-minute appointment? What is generally like when you're feeling that kind of a neg or ache and pain type thing? How long should we look at from an appointment standpoint?
Yeah, I mean, for that point, if you're a new patient, obviously you're going to be like kind of that evaluation and consultation going through that. But I mean, if you're an existing patient, been coming in and like notice something like that, I would say, it depends on like the severity of it. So, anywhere from like, that 15, probably around like the 30-minute range, if it's, been a little bit since you've been coming in, because that gives plenty of time to kind of dive into the area, kind of see what's going on there, and a little bit of time to get that laser on there as well after doing a little bit of some treatment. But yeah, and like you were saying, Barry, it really does come down to like, there's going to be multiple different areas that are involved in anything. We, here at Head to Toe, we take a look at the body as a whole, and we really try and like, okay, figure out why was this happening and really get down to the root cause of it. So, I feel like we do a great job of that. I mean, laser has just kind of, ever since we've gotten it, added another piece to that in terms of what we can do treatment wise. And it's really kind of opened some things up there, which has been nice.
Sweet. Well, I know what I'm going to do. I'm going to go online. I'm going to click that book now button. I'm going to schedule a thing, and we can try that laser out and see if we can get that issue lined up. Well, guys, thanks so much for sharing on the laser. I know it's a cool piece of tech, and it's one of those things that I think some people have misconceptions about. And so hopefully now we set the record straight on all the different cool ways we can use laser and how it works and how it interacts in the body. So Dr. Lee, thanks for breaking that down. And Dr. Tim, Dr. Ash, thanks for expanding how we can use that and how we can fit that into treatment patterns. And again, if you're like me and you have one of those aches and pains and your existing client, it's so easy to book now with the online booking. It is crazy. I love it. I can just jump on there and find a spot same day, next day, day after. Oftentimes I can find a little place I can get in if I have something I want to get. And if you're a new patient, it makes it really, really easy too. So check that out if this is something that resonates. And until next time, guys, remember, movement is the best medicine. We know that's the case. And now as we're kind of in this moving towards out of winter, springs around the horizon, we want to be moving as much as we can and feeling our absolute best. So thanks everybody for being on the show, and we'll catch you guys on the next one.
Awesome. Thanks, Barry.
Thanks, guys.
Thanks, guys.